Hello, Ms. Jones. My name is Jamia. I'll be your student nurse today, and I am going to be placing a feeding tube in, okay? So what I'm going to do is I'm going to go check my MAR, and I'm going to check your allergies and wash my hands. But first, I would like to verify that you are our patient. Okay, now that I've verified you, I'm going to wash my hands, and I just want to make sure that I have all of my supplies here. So I do have my basin, my irrigation tray, my tubing, gloves, and a towel. Okay, so I am going to place this towel onto your chest. Okay. And I am going to go ahead and prepare the feeding. So now that I've washed my hands, I am going to don my gloves. I've already checked to make sure that I have everything. Okay, just check the doctor's orders, make sure everything is correct. Okay, so now that we've gotten started, I just want to go ahead and remove my tubing and let you know everything that we're going to do today. So I'm just going to, okay, so now that I've already got my ice chips, my water, my tissue, I just want to go ahead and let you know everything that we're going to be doing today, okay? So I just want to take the tip of this and measure from your nose to your xiphoid process, okay? And while we're doing that, I am going to tape off where I need to stop. So I just want to measure and make sure that we're going to get the correct placement, and I'm going to go to your xiphoid process, okay? And take that down. And I am going to give it a little slack, okay? So now that we have taped and measured, I am going to take my tubing and dip it 3 to 4 inches into my lubrication. Okay, so I am going to give my patient ice chips or water, whatever she chooses, to have her to swallow as I'm placing the tubing in. I'm also going to ask her to put her chin to her chest. Okay, Ms. Jones, if you could please put your chin to your chest, and then I'm going to start placing the tubing, but I'm going to ask you to swallow, swallow, swallow as I am placing the tubing. Okay. So Ms. Jones, please swallow, swallow, swallow for me. I know that this is uncomfortable. And if my patient was to reject it, I would take it out, okay? So as I am doing this, I will go ahead and secure my tubing with some tape and make sure that she's comfortable, and I'll also clean up anything that's on her. So now that I've secured my patient's tubing, I am going to aspirate 30 mLs of the stomach residual, and I'm just going to make sure that it's in the right placement by x-ray. Okay, after we've done that, I am going to remove the towel from Ms. Jones and make sure that she's comfortable as possible. Okay, and I'm going to get rid of my linen. Okay, so then I am going to hook my tubing up to my feeding, and then after that, I just want to make sure that everything is in the correct order. I'm going to go ahead and remove my gloves. Okay, so after I have removed my gloves, I am going to let my patient now out of high powers and get her into the safe position, and whatever position is comfortable for her. Okay, and then after that, I'm going to wash my hands and document. Hello, my name is Jamia. I'll be your student nurse today, and I'm going to remove your NG tube. But first, I am going to check my orders, verify my patient, and make sure she's not allergic to anything. Okay, and also I am going to check the nose for occlusions, like I did when I inserted it. Okay, so what I'm going to do is wash my hands and don my gloves. And I'm going to place a towel on my patient's chest. Okay, so as I am removing the tape off of my patient, I'm going to go ahead and discontinue her feeding. And then I am going to let her know that I need her to take a deep breath. Okay. All right, Miss Jones. So what we're going to do is go ahead and remove your feeding tube. And as I'm removing it, I just want you to take some deep breaths. And we're going to get this out as quick as possible, okay, for you? Okay, Miss Jones, are you ready? Okay. Okay, Miss Jones, deep breath, deep breath, deep breath. Okay, okay, we're done. Great. Okay, so I am going to discard of that. Okay, so before I remove my gloves, I am going to clean around her nose, make sure there's nothing around, and just get everything out. And then I am going to remove my gloves, wash my hands, and document everything.